Hello everyone, this is Dr. Shishma Sirilla, consulting homeopath at Fidicus Homeopathy. Today in our hair fall series, we have come to the third topic, which is nothing but Telogen Effluvium. So why are we discussing about Telogen Effluvium? First thing is that this Telogen Effluvium is the most common type of cases that we encounter in the clinical practice. Second thing, it can affect both genders, that it can affect males as well as females. And third, it can affect any person at any given age, like it can affect teenagers, and also if it can affect people who are in their adult age. And most importantly, why are we discussing about telogen effluvium is that it is a reversible condition. So what should we do to reverse this telogen effluvium? We can grow back our hair after being affected by telogen effluvium. So what should you do to grow back your hair, and what are the causes of it that are making their hair fall? Let us dive into the topic to know more about this telogen effluvium. What is telogen effluvium? As you can see here, as you can see in the picture itself, it is temporary hair loss. So T stands for telogen effluvium. Here you have to remember the T, which is temporary hair loss condition characterized by increased shedding, that is too much of hair shedding, and often due to a certain kind of a stress. Remember, the stress can be physical form of a stress or emotional kind of stress. At any particular given event in the life, any sort of stressful event, and after 2 to 3 months, you're starting with a lot of hair fall or lot of hair shedding, then this condition is called as telogen effluvium. So let's get into the signs and symptoms of telogen effluvium. So increased hair shedding is one of the important features of telogen effluvium. As you can see here in the picture, we have already discussed male pattern baldness and female pattern baldness. As I told you, in the male pattern baldness, it's usually temporal and there is receding hairline, and also there is hair loss in the vertex area near the male pattern baldness, whereas female there is lot of hair loss in the temporal region and also receding hairline. So but here in telogen effluvium, there is overall hair shedding. Okay, so there is no particular site where there is hair fall only in that region. In male or female pattern baldness, you can see that particular nature and also overall hair shedding. But here in telogen effluvium, you will see overall hair shedding, overall hair thinning without any scalp disorders, that is without any psoriasis of the scalp or eczema or seborrheic dermatitis or any malaria fungus infection. Without any of that, there is hair shedding, there is hair thinning, there is discoloration of the hair, that is from the black color their hair will start to become brown, and in certain section of people, if the stress is really strong, it can become grayish or white in color in a very limited period of time. With there is severe hair loss in this period of time. And also not only that, there is widening of the scalp. As you can see, there is thinning, there is shedding, and there is also widening of the scalp. Along with that, what else do you have is that there is hair volume reduction, hair color changes, there is scalp tenderness. So what do you mean by scalp tenderness is that, see, you do not need to have any sort of scalp infections, but there is scalp tenderness. What is scalp tenderness? If you're touching it, then is there any pain? No. Usually, see, if you're like combing like this and putting on some sort of a plucker or something, and when you remove the plucker and when you touch the hair root away from what it was combed, you will feel certain type of pain. There is pain near the hair follicles, and there is itching for some people without any scalp conditions. So all of these are common features of telogen effluvium. Next, coming into the investigations part. So what are the investigations you need to do if you are suffering from telogen effluvium condition? The first and foremost is history and physical examination. In that, there is detailed history. If you are suffering from sudden hair loss after an event, what are the events? We will be discussing it in the causes. But if you are suffering from sudden hair fall without any, you have not noticed any sort of a hair condition before, but suddenly you have started it, suddenly there is hair thinning, suddenly there is widening of the scalp, suddenly there is hair discoloration, and there is pain in the root, then you should go to a doctor, have a doctor consultation where they will be taking the history part. If they will notice any sort of physical stressful history or an emotional stressful history, they will tell you certain investigation. So the first one is physical examination. We have already heard about this physical examination in male pattern and female pattern baldness, that is the pluck test. What is the pluck test? They will be taking a section of your hair, they will pluck it like this, and when they do that to overall hair, all over the scalp, taking sections, if there is more than 10% hair fall or hair coming out during the pluck test, that is positive for hair fall. As you can see here in the picture, pull test or pluck test, if it is negative, then there is different condition. If it is positive, it is either telogen effluvium or alopecia, that is hair fall due to androgenic causes, that is male pattern and female pattern baldness. Then coming to the other types of tests. Remember, as I told you, it can be a physical stressful event. So what is physical stressful event? Any sort of viral infection, acute bacterial infection, or it can be any sort of surgery that you have gone through or chemotherapies that you have gone through. All of this can come under physical stress to the body. It can be oxidative stress because of certain crash diets that you're doing. All of this will come under physical stressful events. So to know if there is any physical stressful event or any infection or any inflammation in the body, you need to do certain tests like CBC, which is complete blood count, where in the WBCs or in the RBC you will see if there is any sort of iron deficiency anemia, where there is fall in the PCV, packed cell volume, MCH, MCV values, and also the WBCs represent if there is any infection. If there is an acute infection, acute means sudden rise of temperature, it can be fever or anything which is less than 6 weeks in nature. If there is that, there will be rise in the neutrophil count. If there is chronic infection or inflammation in the body or allergy in the body, you will have lymphocyte count raising and also the eosinophil count raising if you have any sort of allergies. So to know all of these, you need to do a CBC. Iron and ferritin levels, if you are having iron deficiency anemia or if you are having any sort of anemic condition that the doctor will notice, they'll ask you to do an iron and ferritin level. Vitamin D, vitamin B12 also, if you're having low absorption rate or if you're not taking enough food or if you're not being exposed to sunlight, that can also lead into telogen effluvium. Thyroid fluctuations are very, very important in people who are in their starting stages of thyroid will have telogen effluvium condition. And also raise in the ESR, which is erythrocyte sedimentation rate, which occurs in any sort of infection, either viral or bacterial. You will be having a raised ESR. If you're having a raised ESR after an infection, it will stay for some time even after an infection. So if there is raised ESR, that means there is physical stress which can lead into telogen effluvium. Next, what are the other kinds of tests that you need to do? According to, like, we have done the blood test, right, and the hormonal test. Now we need to do tests regarding the hair. So what are we doing? Trichogram, pictotrichogram and trichoscan. What is trichogram is that, as you can see here in the picture, they will pull out the hair and then they will be viewing under the microscope. This is called as trichogram, and the pictorial representation of it is called as phototrichogram. And then you have the third one, which is the trichoscan, where they will be telling you, how many follicles are arising from a single given area section and how is it, how dense are it, all of this will come under this. Next, apart from that, you need to do other investigations for your hair, that is dermatoscopy and scalp biopsy. When to do dermatoscopy? If you feel that there is any sort of scalp condition to exclude scalp diseases, you need to do dermatoscopy. And also if you're not able to understand any sort of underlying causes, then you have to do a scalp biopsy. Here whatever you're seeing is called as dermatoscopy of the scalp, and here whatever you're seeing, that is the punch test of the scalp, that is called as scalp biopsy. See, if in the all the physical examinations or the investigations that we're doing, if there is nothing that you can trace out to be the cause of telogen effluvium, then we go into this section. Usually we will do the basic section, that is the CBC and hormonal test along with the trichogram test. Now let's get into the structure and functional part of the hair. So we'll understand what is going wrong, what are the causes and where it's going wrong. So as you can see here in the picture, this is the cross section of the scalp. This is the epidermis part, this is the dermis part, and this is the hypodermis part. So in this epidermal part, you will be seeing the hair shaft, whereas in the dermis part, you will be having the hair follicle or the origin of the hair. See, there is blood supply here. If there is any sort of problem in the quality of the blood, that can also cause the hair follicle to fall off. or if there is any problem in the hormones which are traveling in the blood itself, that can also cause the hair to fall off. And also remember that if there is any sort of physical stress that is represented in the body, or there is changes in the blood quality, which will also make the hair fall. If there is emotional stress also, that will also make the hair fall. So how is this hair falling is that any sort of given stress or a cause, see, it will affect the hair. How will it affect the hair? Hair has three phases, okay? The majority being the growth phase for 2 to 8 years, the other being the regression phase where it doesn't actually grow, or even it stays the same, that is called the regression phase for 2 to 3 weeks. And then the other one is called as the falling phase, which is for 2 to 3 months. Whenever a hair follicle is developing a year, it will grow for either 2 or in between from 2 to 8 years. After that, it will go into a phase called the regression phase, where it will stay for 2 to 3 weeks, and after that it will go to the falling stage. This is the usual cycle. After the hair follicle has fell off, there will be another hair follicle developing. This is the natural cycle of the hair. Apart from that, you have to remember that any problem with the protein intake, because the hair is made up of keratin protein. So here you can see the cuticle is made up of keratin protein. It has cortex and a medulla. Any problem with the protein intake also will affect the hair. So you have understood the structure of the hair, and you have understood the cycle of the hair. What is the function of the hair? The primary function of the hair is not to for aesthetic purposes. It is for thermoregulation. It can be on the scalp, it can be on the body, it can be anywhere on the body. Mainly it is to thermoregulate, so that your body is working under certain given temperature range. If it goes beyond that, through sweat, through the pores and through the hair follicles, it is maintained, a certain temperature is maintained. And also if you are in cool climate, through the hypodermis, which acts as a layer, where it will trap the heat inside and it will not allow it to go outside. This hair is also acting as a protective agent, where if you're going directly into the sun, it will not allow the scalp to directly have contact with the sun rays, so it is protecting your scalp as well. So it's mainly for thermoregulation. It is also mainly for protection also. So you have understood the structure, you have understood the function of the hair, and also the hair represents, a healthy hair represents the healthy body. Any problem in the body will also have a problem in the hair itself. So let's go deeper into the topic to know more about telogen effluvium. Now let's get into the causes and risk factors. See, as I told you already, stress, it can be physical stress or emotional stress. The main cause, or how you define telogen effluvium, is through stress. So by stress, what do you mean? By stress, it doesn't just mean mental stress, that is any work-life imbalance, or too much of work, too much of a stressful job that you're facing, or it can be a stressful stage where you're emotionally not in a good place. Not only this comes under stress, but also there is something called as physical stress. So what is physical stress? Any hormonal fluctuation. It can be pregnancy for a woman, it can be menopause for a woman, it can be perimenopausal stage, it can be the teenage stage where you're hitting puberty, it can be thyroid fluctuations. All of this will come under hormonal changes. And for men, it can be any sort of puberty changes that you are going through, or it can be thyroid. So all of this will come under the hormonal changes. And then medications. If you're using too much of medications, for example, if you're using medication for your diabetes mellitus, if you're using medication for your hypertension, if you're a female and you're taking medication for your ovarian cyst, or for PCOD, or for any other sort of female complaints, and you're stopping those pills suddenly, then that will affect, because your body, even thyroid medications also. See, many people would like to shift from the allopathic form of treatment to the homeopathic form of treatment because it's a safer alternative. But what they do is they suddenly stop whatever they are using and they shift into homeopathy. Or you can shift, or because you're shifting into any other sort of medications as well. If you're suddenly stopping a given medication, the body is used to that. You have to taper the dose slowly, and then along with homeopathic medications, you have to give allopathic medication and slowly taper it. If you're suddenly stopping it also, you will face this telogen effluvium. So if you are shifting to any form of medication, remember not to suddenly stop any medication. Even it goes with alcohol also. If you're drinking alcohol on a daily basis and then you suddenly stop, your body will have withdrawal symptoms. So it is the same also with the medication that you're using. If you want to shift to a safer alternative like homeopathy, you have to taper the dose slowly. You have to consult the homeopathic doctor and lead according to what they say. Okay, do not stop any medication suddenly. That will cause an effect on the hair follicles also. And then nutritional problems. So what do you mean by nutritional problems? I am eating well and I still have telogen effluvium. Remember, if you're doing any sort of crash diets, if you want to lose certain amount of weight of certain kilograms in certain given period of time, that will also, the diet charts that you're following might not have enough nutrition or might not be calculated for your, everyday work basis. The nutrition that you need depends on the work that you're doing. So if they are not in balance, that can also lead to nutritional deficiencies. And also, not only these diets, people who are continuously under stress will have gastritis symptoms, and these gastritis symptoms people use proton pump inhibitors, where there is decreased amount of absorption. And also people will suffer from IBS, which is irritable bowel syndrome, where whatever they eat, the nutrition is not absorbed through the intestines. So if you are having any sort of these problems also, you will be facing nutritional deficiencies if you're not eating properly, or if you're having any sort of gastritic issues. Underlying health issues like hypertension, it can be diabetes, it can be any sort of disease like cancer or HIV or anything. When there is, body is going through some sort of stress, it can also lead into hair fall. And if you're not treating this underlying hair issues, this temporary hair loss can convert into chronic one. Infections and fevers we already discussed, bacterial, viral, any sort of fevers, high fevers, usually which are crossing 101, can lead into telogen effluvium after 1 or 2 months after your infection has started. And then postpartum hair loss, which is also very common while in lactating mothers. And then discontinuing medications, we have already discussed that in the medication part. Now let's get into the body changes part. So you have known all the causes and all the risk factors. So you will know now what is the common thing that is happening in the hair follicle in this telogen effluvium that is causing the hair fall. As you can see in the picture right here, see there are medical terms for this growth phase called as anagen, telogen and all of this. We are not discussing the medical terms as it might confuse you. So we are just going to discuss it as growth phase, regression phase, falling phase. Okay. So what happens, I already told you that your hair needs 2 to 8 years for it to grow, and then it will go into a stopping stage called as regression for 2 to 3 weeks, and then it will fall off within 2 to 3 months. So what happens is, under given circumstance, it can be poor blood quality, sudden drop of iron, or drop of iron which you're not able to notice, and suddenly you just feel your heart thumping, you feel palpitations, you feel like you have pale tongue, you have pale eyes, your skin is waxy suddenly. See, your body has been showing symptoms and then you do not recognize it, and suddenly you just feel these during this condition. Or if you're having anxiety or palpitation issues, or if you're having any sort of vitamin deficiencies, or if you are under the attack of in any sort of infection. And then now in this telogen effluvium, we will see as I told you that hair needs 2 to 3 months to fall off. So what is making this hair to fall off, and what is this time period of 2 to 3 months, what happens in the hair for it to fall off, we will see in detail. See, growth phase 2 to 8 years, I told you, right? Any given cause or any given risk factor will cause an alteration in the hair cycle primarily. So this alteration, what will happen is, this growth phase it will stop. So there is no growing of hair, first thing. In the telogen effluvium, under given circumstances of causes or risk factors, hair stops growing, first thing. Second thing, what happens is, after the hair stops growing, where it should go to? It should go to the regression phase, right? Or it should go to a standstill phase. So it will go to a standstill phase and then it will go to the falling stage. So in this given 2 to 3 months, all the hairs, majority of the hair will go to the regression phase, and from the regression phase it will go into the falling phase. And from the falling phase, when you start to comb, when you start to pluck, when you start to braid, hair will start to fall off very severely. So all of this happens within a given time period for Many people 2 to 3 months, for certain section of people 1 to 3 months. Okay, so after the given stress is gone off, the ESR, the inflammation has come down, the infection has gone, the body is starting to build up nutrition, good nutrition is given, then the growth phase will start. Whenever the growth phase is starting na, last hair follicle or the old hair follicle will fall off and the new hair follicle will start. So this is where you will develop the baby hairs. Okay, when you're starting to develop baby hairs, you will understand that the hair cycle usually na, the growth phase should be 80% in the given scalp. The regression and the falling phase should be 10% each. But in telogen effluvium, this 10 or 20% of this this regression and the falling phase will shift into 50%, and the growth phase will really fall off. So 50% of the hair might fall off in 2 to 3 months itself. Okay, and after that, new hair follicle will start to come, and baby hairs will start to develop. But baby hairs are not that thick, right? In the starting, they need time to grow. This is where you will be feeling that you will have lost a lot of hair, and also the scalp has become wide and also hair has become thin. To regrow your hair properly, you need certain things. What are those certain things we'll be discussing next? We are going to next discuss about this conventional form of treatment. Here, everybody who is watching this video, a major percentage, that is 80%, might have used minoxidil. So minoxidil is used so that you will get these hair follicles will start developing. That is, it pushes the hair into the growth phase. Okay, so if minoxidil is given and you're continuously suffering from stress and that stress is not taken care of, this minoxidil is of no use. That means you will have baby hair, but it will fall off as soon as you stop using minoxidil. Second thing, if it is physical stress because of some sort of hormones, if you're not taking care of the hormonal problem and you're using minoxidil, baby hair might develop, but it will fall off eventually after stopping, so it is of no use. And third thing, if you are having any sort of infectious, after infection you have started developing this telogen effluvium, if you are not taking nutritional supplementations, if you are taking this minoxidil, it will grow your baby hair, but it will eventually fall off after stopping. So all of these conditions, whatever minoxidil is providing, you have to take nutritional supplementations, and also you have to take care of the cause. If you're not taking care of the cause, then this minoxidil is of no use. And also prolonged minoxidil usage is not advised, because minoxidil can cause irritation of the scalp, it can cause dryness of the scalp, and also in certain section of people it can cause seborrheic dermatitis as well. So remember, if you're having any sort of hormonal changes, any sort of after infection hair fall, better to choose something which will give you a medication which will have no side effects on you. Next form of treatment is nutrition supplementations. Be it any form of treatment, you need nutritional supplementations for your body to grow your hair back. Next, low level laser therapy and PRP. If you are having any problem in the blood, the quality of blood is not proper, then what is the use of getting a PRP done, because the blood quality is only not proper. After taking the blood, they are injecting here. So if the quality of blood is not good, PRP is of no use. So improve your blood quality first. Along with that, you can take homeopathic medication which have no side effects, and you can take PRP therapies also, so that combined they can give you much better effect. As well as also the low level laser therapy will help in stimulating your hair follicles. You can take homeopathic medications for your whatever given cause without any side effects, and then you can stimulate it through low level laser therapy. Then you can combinedly you can have good effect. But your homeopathic doctor will tell you if you need this low level laser therapy or this PRP therapy, or the medications will be enough. Next is the hair transplantation. If there is severe form of stress and all the hair follicles have gone into your this telogen phase, that is the regression and the falling phase, then you will be needing hair transplantation in severe cases where the hair follicle has started to close. But usually if you are going to a homeopathic doctor and you're taking medications, you will have good effects, especially telogen effluvium cases. They are very responsive for homeopathic medication. Now coming into the homeopathic part, why should you choose homeopathic treatment over conventional forms of treatment? As I already mentioned it to you, see, minoxidil, it can cause scalp issues, and also after stopping it can cause your hair to fall. Second thing, low level laser therapy and PRP without any given cause addressing, and if you are not addressing the cause and you're doing these, it's of no use. Third thing is that your hair transplantation, it is only necessary when your hair follicles have closed and they're not responding to anything. So, and also, all of these conventional form of treatments do have certain side effects and also certain stigmas associated with it. For example, you're getting low level laser therapy, you've gotten so many sessions, but your hair is not responding. So what will you do? Because there is certain underlying cause, you need to address that, and the cause can be hormonal problem, your stress. Remember that what are you going to do with stress, people might ask. See, remember, homeopathic treatment, the medications are especially designed in a way that hair fall after an acute disease, we have good number of medications. Hair fall after financial stress, we have medications. Hair fall after, given emotional disruption, we have medications. And we have good number of cases where we are dealing with emotional distress and hair fall, physical distress and hair fall, hormonal distress and hair fall. So homeopathic offers a wide range of medications which will treat not only scalp issues but overall if there is any sort of problem with body hair also after a given form of stress, homeopathy can help. Okay, and it is safe. There are no side effects in homeopathy. There is addressing the cause, which is very, very important, so that it will not reoccur. And along with that, if you want, if it is advisable, you can take a PRP or a low level laser therapy, and combined with that, you have to mainly include good nutrition and diet to get your hair back. Okay, so homeopathy can be said as the better choice of medication than allopathic form of medication. Now coming into the precautions part, which is very, very, very important for hair fall: proper nutrition. Everybody talks about proper nutrition. So what is this proper nutrition? Remember that if you're taking a bowl, let me explain it to you in very, very simple terms. Okay, if you're taking a plate, your food, it can be breakfast, it can be lunch, it can be dinner. Divide it into 4 parts. Okay, first part, you should be having fiber, which is very important. And the second 2 parts, okay, the one you're dividing into 4 parts, right? One part is fiber, the next 2 parts should be protein either from animal source or protein from vegetable source, and then the last part should be your carbohydrate part. If you're dividing your plate like this and eating your morning, that is your breakfast, your lunch and your dinner, you will address these nutritional deficiencies, and also your blood quality will also improve. When you're taking this fiber part, make sure that you're taking leafy vegetables regarding your concerns. Like for example, if you are having any sort of iron deficiency, take a lot of spinach, that is palak, which will address this iron deficiency. If you're suffering from kidney stones, or if you're suffering from emotional and physical trauma as well, try to take a lot of moringa. So each leafy vegetable will have a certain concern associated with it, which can be treated with that leafy vegetables. So do a little bit research on that and start consuming your leafy vegetables or the fiber part. And the protein part, if you are suffering from hormonal disruption, avoid red meat, which is mutton, which is lamb, pork and beef, and you can take chicken or fish. And also try to include a lot of nutty sources as well, like almonds. You can include cashews, you can include seeds and nuts also in the protein part. And then coming into the carbohydrate part, make sure you consume carbohydrate which is low in glycemic index, like you can consume millets or you can consume rice, you can consume brown rice. And also very importantly, if you're consuming rice, cook it in the morning, after cooling down, refrigerate it, and then you eat it. The glycemic index will decrease, and also resistant starch will increase, making it, the glucose spike is not like this. If you're eating freshly cooked rice, the glucose spike will be like this, but if you're eating refrigerated rice, it can be like this. It is a slow glucose spike. So make sure that you do all of these precautionary measures. Stress management, very, very important. If you're going through physical stress, then you can use homeopathic medications. And also if you're having emotional stress, you, along with the homeopathic medications, you need to have a psychological or psychologist to analyze your behavioral pattern, because they will give you a fresh perspective on the problem. So try to talk to a psychologist or a psychiatrist if you are suffering from intense psychological problem, so that your stress will be managed. And also try including yoga, and also do pranayama. Try stretching, as it will release the muscle tension and make you free mentally as well as physically. Proper sleep cycle. See, no amount of talk on sleep will be enough. Remember that men need up to 8 hours of sleep, whereas women in their reproductive age will need 9 to 10 hours of sleep. Good amount of sleep, I'm telling you. So make sure your sleep cycle is proper, because that can also affect the hair follicles. And then proper hair care. Do not use a lot of different stuff on the hair. Use regular shampoo which is useful, like you have been using for a longer period of time, or try shikakai, konkud kai, or that is whatever natural ingredients are there in each country to cleanse your hair. Try to use that. If you're staying in USA, they have certain things that they use to cleanse your hair, so use that, which is natural in nature and which is very organic to their land. If you are in India, use a natural cleanser or a hair cleanser which is organic in India. So it depends upon the land that you're staying. Try to use cleansers which are natural for your land as well as for your hair. And then avoid unnecessary styling of your hair, and treat underlying conditions, which is very, very important in telogen effluvium cases, so that we do not convert it into a chronic disease. So what happens if you're not addressing the telogen effluvium, or if you're neglecting telogen effluvium? Remember that telogen effluvium is an acute condition. It is temporary in nature. It can be reversed through medication with nutrition supplementations and good amount of stress management. But if that is not taken care, this acute condition get into chronic condition, and even in the chronic condition not taking care, it will lead to baldness, because there is hair follicle will become closed, and then you will have you will not have any growth on the scalp, and that can lead into baldness. Apart from that, if there is no hair on the scalp or on the body, it can lead into a direct heating. When you're going out in the sun, sun rays can directly hit your scalp, and there is no protection. You can have a lot of water loss, and also you can faint if you are not taking proper physical barriers. If you're not putting any sort of physical barriers like hats or umbrellas while you're going into the sun, it can be a little bit of problem, especially if you're living in the tropical areas. And also the medical condition which is causing this telogen effluvium can have a bad prognosis if not treated in the starting stages. So try to make sure that you address the cause of the telogen effluvium. Now coming into the consultation part, if you're suffering from hair fall issues and you would like to get in touch with us, we have two types of consultations here at Fidicus Homeopathy. One is the offline consultation or the in-person consultation. If you're staying near the nearest branch of Fidicus Homeopathy, you can come and consult us in person. And if you're staying far away from us, you can consult us through audio or video online consultation. Okay, and after the online consultation is over, or after the consultation is over, we will be asking you for the investigations which are needed. If you have already got it done, you can share it with us. And after this part, especially to the online clients, we will be sending you our medications to your doorstep. If you're staying in India, it can take 3 to 4 or 3 to 5 business days. If you're staying in USA, 3 to 5 business days. And if you're staying anywhere else, it can take 4 to 8 business days for our good medicines to reach your doorstep. If you would like to get in touch with us, you can call us, WhatsApp, ping or messages on this number which is displayed here. And also if you would like to know more about us, you can check our website www.fidicus.com. If you're watching this video and you're suffering from hair fall or hair fall issues, and you are looking for cure, why should you choose Fidicus Homeopathy? Here at Fidicus, we stand for highest chance of health, and we follow 3 principles. What are that? First one, we are already having good success in hair fall cases. Second thing is our transparent treatment here at Fidicus. There is no gray area between the patient and the doctor. Here we will be talking to you about your case and also about your prognosis and the personal care here at Fidicus Homeopathy. What is personal care given? If you're having any sort of queries, if you're having any sort of doubts, if you're having any sort of fears regarding this hair fall, all of this, you will be educated on that, and you will be given proper, education on whatever issue you're suffering from. So if you're wanting to choose cure, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.